Hello once again. How are you feeling? I hope you're feeling good because we have one more presentation before the live Q&A with the professional panel. So don't leave just yet. Last but certainly not least, we have our Heart Health Essentials presentation. This presentation is brought to you by Dr. Rose. Dr. Rose is a practicing cardiologist in the Riverside area. He is currently board certified in cardiovascular disease as well as lifestyle medicine. His true passion and interest lie in the power that nutrition and lifestyle changes have in the prevention and treatment of cardiovascular disease and its risk factors. Before we start, remember to type any questions that you have in the comment section, so that way they can get answered at the end of the event during the live Q&A session with the professional panel. Enjoy the presentation.
Well, hello, everybody. I appreciate the opportunity to talk to you a little bit today, about 30 minutes or so on some heart health. I appreciate the Riverside Community Health Foundation supporting this, and hopefully you get something positive out of it here in the next 30 minutes or so. I'm Dr. Rose. I'm a cardiologist here in Southern California. These are my slides, my own opinions, and I don't have any financial disclosures or interests today. So what are we doing today? Well, we're going to basically be talking about some risk factors for coronary artery disease, both for men and women. We're going to try and see if you can recognize how these risk factors result in cardiac disease. And then, what are some ways we can try and prevent the disease from actually forming? So this is a slide I usually start with. So it's taken from the National Vital Statistics Report. And what it looks like is basically what are the causes of death for both men and women. And this is the most current data they have from 2019. What I think you'll find is that the #1 cause of death for both men and for women is both heart disease. And that's followed very closely by cancer, as well as other diseases that you're probably familiar with, things like diabetes and stroke. CLRD is chronic lower respiratory disease, basically emphysema and COPD. So currently heart disease and cancer are #1 and #2 killers in this country. And so when we actually look at these different causes of death, like heart disease, like cancers, like stroke, like lung disease, what we find is that the majority of this is related to tobacco, to our poor diet and inactivity, and to high risky behavior. So that's heart disease, that's cancers, that's strokes, lung disease, diabetes, largely lifestyle related causes, which is one of the things I want you to get out of this talk today. So we use the term heart disease a lot. What does that mean? Well, heart disease is everything, problems with the valves and the plumbing and the electricity of the heart. But the #1 issue we deal with heart disease is largely coronary artery disease. So what does that mean? Well, the arteries in the body basically have 3 layers to them, or 3 linings: the adventitia, the media, and the intima. And so this is normally very healthy tissue. It's very smooth. It's able to contract and relax very normally. What ends up happening is we start developing these fatty streaks, these cholesterol deposits in between the walls of the arteries. And there's data to show that this happens very early in life, as early as our teenage years, these fatty streaks. And then over time, that fatty streak becomes increased, more cholesterol, and it gets stressed by things like high blood pressure, cigarette smoking, high inflammatory states like diabetes and obesity, and the plaque becomes thicker. There's almost an immune response that happens within this plaque and becomes very unstable over time. And that really thin cap that kind of holds in all that plaque can rupture and tear. And very similar to what would happen if you were to cut yourself shaving or something of that nature, you basically bleed into the tunnel of where the blood flow goes. And that can form a clot called a thrombosis. And it's that bleeding into the vessel, the clot formations, that can either partially occlude or completely occlude a vessel and cause a heart attack. So, these fatty streaks and everything that starts this whole process, where does that come from? Well, it largely comes from cholesterol. If you were to go see a regular doctor and you get a cholesterol panel, there's basically 4 things that you get on that cholesterol panel. There's a total cholesterol, there's a low density lipoprotein, which is LDL, and high density lipoprotein, HDL, and then triglycerides, which are things like fats and oils. We tend to focus as cardiologists a lot on the LDL because that's the bad cholesterol. Think of L as lousy. That's the one that gets deposited in the arteries, causes the coronary disease. HDL, that's H for happy. Think about that as the good cholesterol. That might be a little bit protective. LDL is the guy that we worry about here. And so people ask me in clinic, well, how low should my LDL be? Well, to be perfectly honest, we're born with LDLs of about 40 or 50. And then over time, as adults, the LDL generally increases. And what we know is that basically, as of right now, the lower you can get your LDL is better. So if your LDL starts at 160 and you go to 130, that's great. If you can go from 130 to 100, that's even better. And we know that there's data out there to show that if you can get your LDL lower than about 70, you really don't make plaque. Because that's kind of the goal number, but the idea really is lower is better. And cholesterol only comes from animal products. I'm going to repeat that. Okay? So cholesterol is only found in animal products. So what's high in cholesterol? Things like the egg yolks, butter, shrimp, ribs, cheese, chicken, fish, shellfish, very high in cholesterol. Things that don't have cholesterol are basically your non-dairy milk, so like an almond milk, a soy milk, or rice milk. Egg whites actually don't have cholesterol. All the cholesterol is in the yolk. And fruits, grains, nuts, vegetables, all basically zero cholesterol containing foods. So cholesterol is a risk factor. One of the other risk factors that we know about is smoking. So this is showing some information basically here on the bottom of time. This is starting off in the 1900s, 1950s, 60s, all the way up basically close to present day, versus the amount of cigarettes that are consumed. Cigarette smoking was rampant, especially in the 20s and 30s, World War I, World War II. Heck, even doctors would recommend certain brands of cigarettes. And then over time, we realized that Jesus is causing cancer, it's causing heart disease, it's causing lung disease. And there started to be some movements to reduce cigarette consumption. The Surgeon General put out the warning in the 60s. They increased the taxes of cigarettes. They found out that secondhand smoke causes disease. And so over time, the amount of people that are smoking cigarettes has gone down. So we've made some positive movements with that, but still to this day, you can go out and buy cigarettes by the carton. We know that cholesterol is a risk factor. We know that cigarette smoking is a risk factor. Diabetes is an issue as well. So this is showing time here on the bottom from the 50s, 60s, all the way up to present day versus the percentage of people with diabetes. So the percentage of people with diabetes has gone up unbelievably since the 60s. Now almost about 10% of the country has diabetes. So this is an issue. And so what we find is it's not like 1 + 1 risk factor equals 2. These risk factors are additive. So if you're someone who smokes, that has high cholesterol, that has diabetes, your risk of heart disease becomes very, very high throughout the course of your lifetime. What else is a risk factor that we're learning? Obesity. So unfortunately, we're dealing with the COVID-19 pandemic. Obesity is an epidemic that's well recognized by the Center for Disease Control. So this is a slide from the CDC looking at the obesity rates throughout the country, color coordinated here on the bottom right. And so in the mid 80s, there was just a few countries that basically were reporting obesity, maybe of about 10% or so. And fast forward 10 years later here in the mid 90s, now there's a much greater percent of the country that's got obesity rates over 15%. Fast forward another 10 years, they're having to change the colors. Multiple states, obesity rates in the 20%, 25%, even some showing up as high as 30%. Here's about 10 years even after that, even higher rates with now states reporting obesity of 35%. So obesity is growing at an unbelievably high rate in our country. This is the most recent data from the CDC on obesity. That was the data basically from 2017-18. Again, you see the obesity trends going up and up, where basically 42% of the country is considered obese, which is basically a body mass index greater than 30. Obesity doesn't matter anything about your ethnicity. So this is overall obesity data. Again, multiple states with obesity rates greater than 35%, even states that we think about, like our own, in California, having rates of about 25 to 30%. It's even worse in the Hispanic population. Very high rates of obesity, not just in California, but throughout the country, and even more prevalent in the African American community. Very high rates, well over 35% throughout the country. And so the challenge with obesity is that it has lots of secondary effects, increases the risk of stroke. I mentioned diabetes, coronary disease, high blood pressure, problems with the pancreas. There's a number of cancers that are linked to obesity, like breast cancer, colon cancer, and cervical cancer. Problems with the gallbladder, fat that develops on top of the liver and the pancreas, and can also even affect the lungs, create problems like sleep apnea, which is a condition where the tissue in the neck ends up blocking off the airway, and you wear a certain mask at night to sleep to help you breathe. With the COVID-19 challenges that we're all facing, there's a lot of data to show that those that have obesity have actually worse outcomes. If you're obese, you're more likely to be hospitalized. You have a higher risk of in-hospital death, maybe even requiring ventilator support, and a higher risk of clotting and needing dialysis. So this is something that's well published in the literature. So with all these different risk factors, the obesity, diabetes, blood pressure, smoking, this leads to the coronary disease. So how are we currently managing the coronary disease? Well, to be perfectly honest, we wait for symptoms to develop. We wait for you to have chest pain or shortness of breath or a heart attack. Then we do a special procedure called a heart catheterization. We lay on a table, we put wires and catheters up into the heart under x-ray. And we basically inject IV dye or contrast into the heart arteries. On the right side of the screen is showing a picture of what an angiogram looks like. And so these things kind of look like tubes. That's your coronary arteries. And here is showing a significant blockage, almost like the artery is being pinched from blockage, again, in the walls of the artery that's occluding flow. So if we see a lot of coronary disease like that in the cath lab, we can put in stents. Stents are basically look like chicken wire that's collapsed onto a balloon. That stent is put across the blockage in the artery, and then the balloon's inflated. It expands the stent and pushes the plaque to the side. I always tell my patients that the stents don't treat the coronary disease. It doesn't get rid of it, it doesn't clean it out, and it doesn't remove it. It's a temporary fix to try and improve blood flow to the heart, but all the disease is still there. If you have worse disease that needs open heart surgery, there's a procedure called a coronary artery bypass grafting, termed a CABG, where you take arteries from the chest wall, veins from the legs, or arteries from the wrist, and you're basically literally bypassing, like tubing, a blockage in the artery. Again, I tell my patients that the bypass doesn't treat any of the coronary disease. All the disease is still there. The bypass is just a temporary plumbing workaround to try to improve blood flow to the heart. And then if you go into the hospital and you have a heart attack, something of that nature, you leave the hospital with a bunch of new medicines, usually an aspirin, some type of super aspirin, class of medicines called beta blockers, other medicines for blood pressure in the heart called ACE inhibitors or angiotensin receptor blockers. Oftentimes nitroglycerin is a spray or tablet under the tongue, sometimes water pills, and then a class of medicines called statins that reduce cholesterol and reduce future heart attacks. So you end up with a whole bunch of new prescriptions when you leave the hospital. So I think Albert Einstein gets credit by saying insanity is basically doing the same thing over and over again and expecting some type of different result, right? So what we're realizing is that these chronic diseases like coronary disease and diabetes and blood pressure, high cholesterol, are basically responsible for the majority of what we spend our healthcare dollars on, up to 80%, though we treat it basically with just pills and injection. And again, this might temporarily, help out with some symptoms, but like I mentioned with the stents, it doesn't address the underlying cause of the disease, which is basically lifestyle related. So this is a message from the chair of National Prevention, Health Promotion, and Public Health. And I basically just highlighted something in this document that said they're really looking to move our healthcare system, which is currently based on a symptom of sick or a system of sick. We're waiting for someone to get sick or a problem to develop, a symptom, and then we treat it. Instead of looking at wellness and actually trying to prevent these diseases that we're treating. So Ann Wigmore gets credit, I think, of how to do that. Well, food is really important, right? So food can basically be the safest and most powerful form of medicine or the slowest form of poison. So when we talk about food, we oftentimes talk in this country about the standard American diet, abbreviated as SAD, by the way, right? SAD, standard American diet. And so what is that? Well, if we look at all the food that we consume in this country, the vast majority of it, shown here in yellow, is processed food. These are highly refined foods with a lot of added fats and sugars and oils, along with a large amount of animal products and a very, very small amount of plant foods and fibers. So the majority of our diet, well over 80%, is basically processed food and animal food. So what is that like? Well, let's think about it like this. Let's say that we're at a meeting for work or something like that, and Dr. Rose comes in, and before the meeting, I'm going to hand out a whole bunch of cigarettes. Well, hopefully most people are not going to light those cigarettes up and actually smoke them. Well, why is that? Well, most people aren't going to do that because cigarettes are bad for you. They cause health problems. They're addictive, and over time, they could kill you. The same regard would be for illicit drugs. Let's say I went to a meeting and I brought a whole bunch of heroin, and I handed out a whole bunch of heroin. Well, most people would probably not inject the heroin. Why is that? Well, because it's addictive, causes health problems, it's bad for you, and over time, it could kill you. Well, what's interesting is what happens when we bring something like this to a meeting. Well, I view it a lot like the cigarettes or the heroin. This is something that's addictive, it's bad for you, it causes health problems, and over time it can kill you. So when we talk about food, what happens? Well, a lot of it has to do with fast food and eating out. All kinds of commercials and advertisements for all kinds of stuff that's out there. And you've seen these commercials if you watch TV. So part of it is fast food and eating out. A large part of it is calories. This is just taking a sample from a bunch of random menus. But things like the amount of calories in the food, the amount of fat, the salt, the sugar, very amazing how high the calories can be. Even for things that, like a salad, for example, at a restaurant could easily have over 1,000 calories in it. If you think about it, let's say an average person should take in about 2,000 calories, geez, one meal could well be half of what you're taking in for your calories. In addition to calories, part of it is portion size too. So first off, what you're served and what a portion is completely different. So what does that involve? It involves you turning over the back of the package and looking not just at the calories or the fat or the cholesterol or the salt, but what's considered one serving. So what you're given might be a cheeseburger and some fries, but what's considered a serving may only be a portion of that. So it's important to turn over the backs of the packages. The portion sizes have increased dramatically since the introduction of kind of fast food in the 50s and 60s. The portions are larger, the size of the fries, the size of the burgers, the size of the soda or sugar infused beverages. Beverages by themselves, by the way, can have a lot of calories. This is an example of, let's say, someone who's taking in a bunch of different beverages throughout the day, not a single drop of food. Let's say you have a glass of orange juice in the morning for breakfast, you go to your coffee place in the morning, maybe you have a pop or a soda there for lunch, you have some type of fruit drink in the afternoon, sweet tea for dinner, maybe you have a beer watching the game. Well, geez, just on drinks alone, just on beverages, you've put in almost 1,400 calories. So again, quite amazing when you kind of look at it like this. What about just some water? One of the healthiest things you can drink as far as beverages, just water. No calories, no fat, no salt, no sodium. Helps your metabolism, aids in digestion and constipation. So think about substituting out what you're drinking during the day for water. So part of it's calories, part of it is the portions, but so much of it is what's actually in the food, and it's largely salt, sugar, and fat that gets added. Start looking at the backs of the labels when you go to the grocery store. Take a look at a thing of canned soup. So you might look at the sodium here and go, geez, 890 milligrams. It's a lot of salt, right? Someone maybe should take in less than 2,000 milligrams of salt. That's 890 milligrams. Well, look at the serving size. That's half a cup. There's actually 2.5 portions of that. So it's 2.5 times 890 milligrams of salt in that canned soup. Here's the back of a label from a pasta jar. 10 grams of sugar. Sugar added, again, to the pasta sauce, not necessary. What about a pickle in the bag? 520 milligrams of salt. What's the serving size? 1/9 of the pickle. So 9 times 520 is how much salt is in that entire pickle. And then oils as well. All the oils, whether it's olive oil, canola oil, butter, about a tablespoon or so of those oils has about 130 calories. This is showing an example of coconut oil, which is very high in saturated fat. But even the oils that we think of as being healthy, like olive oil or canola oil, still are very calorie dense. So, okay, so I talked a little bit about what coronary disease is, talked about risk factors, talked about foods and everything we shouldn't do, right? Well, if you want to make a change in your actual health, where do you start? Well, I think the first thing is to define what a diet is. So if I were to ask everybody what a diet is, people would say, oh, it's this diet or that diet. They usually have a gimmick to them. It's something you start and stop. It's something that doesn't work. Well, if you actually look at the word diet in the dictionary, it's actually a type of food or drink that you consume, and specifically the kind and amount that's prescribed for a person. And I love the word prescribed, and we'll get more into that. So when cardiologists or physicians or healthcare professionals talk about different types of diets, specifically a whole food plant-based diet, it's not really a diet. It's more of a lifestyle choice. It's not necessarily vegetarian. It's not necessarily vegan. Vegetarian says I'm going to exclude meat, but okay with dairy and cheese. Vegan, I'm not going to use any animal products, leather belts, honey, things of that nature. So whole food plant-based just says that you're really trying to avoid all that refined, highly processed, all those foods that are high in sugar, salt, and fat. And the majority of your diet is really focused on fruits, vegetables, whole grains, and legumes. Legumes being things like beans and lentils, chickpea, edamame, things of that nature. And so this data on a whole food plant-based diet is not new. It's been talked about for 30 years. Folks like Dr. Dean Ornish, Dr. Caldwell Esselstyn, large pioneers in this movement over the last 30 years. I'm not going to go through all the research for this, but let you know that it's very well published that lifestyle changes that predominantly involve a plant-based eating style can lower your cholesterol. It can lower inflammatory markers. It can prevent diabetes. It can reverse diabetes. It can improve blood flow to the heart. And it can actually change the type of bacteria that's in your gut to actually make you healthier as well. Michael Pollan has a great quote that he gets credit for. If you're ever trying to think about like, what am I supposed to eat? Well, you should eat real food, probably not too much, and make it majority being plant-based. And when I made this change several years ago, I was thinking, how am I going to do this? How is this going to affect my palate or my taste? And so this slide reminds me that it's a lot like coffee, in that maybe when you're as a kid or something of that nature, you take a sip of coffee as a kid, you don't really like how it tastes. But over time, you get used to it and you kind of enjoy how it tastes and you enjoy how it makes you feel. And I think a plant-based eating style is very similar to that. Maybe at first it's a little bit different to change your palate, but your palate gets used to it. You actually start craving the foods that are plant-based, and you like how it makes you feel. And maybe like a cup of coffee that may give you a little bit of energy, a plant-based eating style will actually make you feel better, and you're going to want to continue to do it. There are lots of resources out there for more information. Again, lots of folks in this field, Dr. Dean Ornish, Dr. Caldwell Esselstyn, Dr. Neil Bernard, Dr. Joel Furman. Lots of folks are out here who have written a lot of books on this that you can look at. Lots of other resources, a lot of good documentaries on some of the movie networks, Forks Over Knives, What the Health, Game Changers. A lot of good documentaries, I think, to help get you started. There's a lot of cookbooks that you can find at the grocery store, kind of at the checkout counter. And we are, I think, blessed here in California to have so many open farmers markets that you can get lots of local fresh fruits and vegetables. I would think about food, like I mentioned before, like a prescription. So just like you maybe get a prescription for one condition or another, think about food as a prescription. It's something you're going to do every day. You may do it several times a day, and you're doing it to treat certain conditions, or maybe to prevent certain conditions from actually happening. And nutrition is just part of this. There's a couple main pillars, I feel, over overall health. Nutrition is probably one of the biggest pillars. Exercise and being active is important. Stress management, sleep, attitude. There's other folks during this seminar talking about things like stress and how that affects heart health. But nutrition is important. Physical activity is important. I mentioned that. We think about that as cardiologists as another risk factor. So just like smoking, just like high cholesterol, high blood pressure, being inactive has shown to increase your risk for having heart disease. And I would think about activity and exercise like a prescription too. So it's something that you do every day, like you maybe take a prescription for something. And what you find is if you can make exercise and activity part of your routine, that it just becomes something you do every day. And you do whatever you can do that your body can do. Can you go for a walk? Can you ride on a bicycle? Can you swim in a pool? Whatever you can do to make exercise and activity part of your regular lifestyle. There's an individual that did a study on the blue zones throughout the country, Dan Butner, basically looked at where throughout the world do people live the longest. And he found 5 areas throughout the world, one right in our backyard here in Loma Linda. And he looked at these folks that live the longest and said, well, what do they have in common? Well, what they basically have in common is that they're active and they move naturally. They have a positive outlook on life. They have good social and family support, and they eat largely a plant-based diet. So if you're interested in the blue zones, there's some great literature on that that's out there. Sleep is really important too, getting good quality 7 or 8 hours of sleep. There's a lot of stuff out here you can read about that, but making sleep a ritual, sleeping in the dark, not eating a lot before you go to bed, not smoking or drinking alcohol before you go to bed. And if you can get a good night's sleep, this really helps with your overall mood, helps with your health as well. So all of these different pieces of eating healthy, being active, and managing stress, it really composes something that's called lifestyle medicine. And it's that's really the focus to try and prevent, treat, and reverse most of the chronic diseases in this country. So I hope you enjoyed the last 30 minutes or so. I think we tried to talk about some of the risk factors for coronary disease that are largely lifestyle related, like diabetes and obesity, high cholesterol. We talked about how these risk factors cause the disease, cause these fatty streaks, the plaques, and it's the plaques that causes the blood flow problems in the arteries. And then what can we do to prevent coronary disease? It's largely lifestyle. It's lifestyle medicine, focused and based on nutrition, and again, being active, stress management, good sleep, and a positive outlook on life. So I appreciate everyone's attention. There's going to be a question and answer session afterwards that I'm happy to answer any of your questions that you may have on heart health. Thanks for your time. I appreciate it.
Wow, another great presentation. Thank you so much, Dr. Rose, for giving that amazing presentation. You really never seem to disappoint with the heart health information that you give. I always learn something new, which is great. Well, thank you all for watching. We're actually about to start our live professional panel discussion where each presenter will answer each of your questions live. But we still have a few extra minutes before we start the live professional panel discussion. So if you've been sitting all day and you need to give a good stretch, feel free to click on the extra workshops tab on the top of the page, and you can click our stretch break video that we provided for you all. Also, be sure to fill out our post survey at the end of the event so you can be entered in our opportunity drawing so you can have a chance to win one of many different prizes that we have. See you soon!